Hey, Dr. Somareddy here again with you today, going over something that's very important in our field of healthcare, especially with physical therapists, is communication with your physical therapist. Kind of a simple thing, but it's important that you guys understand how to do it, because a lot of patients come to us and say, hey, I told the therapist about my problem and I don't know if he really understood it, and he started treating my shoulder and my neck, and it wasn't exactly the right spot, and I wasn't sure if it really helped, and they get into a lot of guesswork and they don't feel like they're being helped. So you want to go to whoever you're going to go to, in my case, physical therapist, and you want to be able to ask and know exactly what the therapist is going to do, but also identify to the therapist what he's going to do. So I'm going to go over some really simple things with you guys so you understand it. Number one, when you walk in the door, make sure you clearly state your problem to the physical therapist. I find a lot of times that patients that don't clearly state their problem to me, it starts the thing off pretty bad. For example, I've had patients come in, they give me an MRI, and then I've stated the problem to them. So it looks like you have a X, Y, and Z condition. And that's the worst thing you can do as a therapist. As a therapist, you want to listen to the patient and have the patient tell you exactly what their problem is. Sometimes it takes a little time for the patient to kind of know what it is, and a lot of times they don't exactly know the problem. So they have to ask you for it, but let the patient clearly indicate what their problem is. Listen to your therapist, right? We as therapists are taught to listen to our patients, and although that's very, very, very important in the first step, the second step is to listen to the therapist. So if a patient says, my problem is my back, and it specifically states it, then I could go over and say, great, let me ask you a couple things, and I'll ask you a couple questions, and I might state a comment that relates to what the problem is and how I can treat it. So listen to your therapist, and make sure you follow exactly what he's saying, because he may not understand it exactly, or if he does, you want to make sure that you've communicated exactly well to him. So it's a two-way communication. Number three, as a patient, you want to clarify. If you have a question about what the therapist says to you and it's not exactly what you said in the first statement here of your problem, you want to clarify. So it's my back, but it's actually my side, and actually just went down to my hip, and it's actually been going on for a while. It's gone on for a couple of months. It happened during what exact time, place, form, and event. It happened during this exercise I was doing, or this car accident, and specifics of how it happened. And you want to clarify that by asking questions. So that's a very important step that you have to kind of look at in talking to your therapist, right? Just make sure that you ask a lot of questions, which then facilitates you to tell him more. And although it might seem like a little bit of a longer step, it's a very important step. So the therapist has to totally understand what you're telling them, which is here in the first part. And that's your clarification step. Lastly, as a patient, you want to summarize. So, I just want to summarize. So basically, we're talking about my hip, the pain. You got that, and how it's going down my leg, and it needs to be treated like such and such and such. Okay, I understand. So you make sure that you and the therapist are on the same page as far as what you both understand, what you communicated. Sounds like a simple thing, but a lot of times the first step doesn't happen, where you come in and clearly state your problem to the therapist, and you come in knowledgeably with that. So I want to give you that tip, and good hunting, and hopefully you guys have great therapy sessions.